With all the uncertainty and anxiety that people face in the healthcare marketplace, direct primary care is a different approach to traditional healthcare insurance. And on the 19th episode of the Local Okie, I am with Dr. Fatima Jaffrey with Crescent Medical, and we will be talking about the direct primary care model and all of its many benefits, as well as the differences between traditional health insurance. If you haven't had the chance to meet, my name is Jimmy Jenkins. I'm the owner of J&J Medicare Solutions, which is an agency that helps boomers and seniors to understand their options with Medicare. Also, I am the creator of the Local Okie, which is a great way for me to network as well as meet some pretty awesome people like Dr. Jaffrey. So, Dr. Jaffrey, thank you so much for being on the Local Okie.
Thank you for being interested in having a conversation about this topic.
Absolutely. I came across a direct primary care model a few months ago, and it's definitely been an interest of mine. So again, I appreciate you taking time out of your busy schedule to be on the show. So if you would, before we get into what the direct primary care model is, just give us a little bit background about who you are, where you're from, and your vision for the Crescent Medical.
Sure. So I am from Oklahoma City.
Okay.
I grew up here, was raised here. I am a family physician. I went to medical school at OU.
Okay.
And then I left Oklahoma for the remainder of my training. I was in the Northeast. I was in New Hampshire, and then on Long Island, right outside of New York City. I'm not only a family physician, I have specialized expertise in healthcare delivery science, which is an emerging field of expertise looking at payment systems and evolving healthcare systems and meeting the needs of populations in the community.
Okay, awesome. And so what is direct primary care?
Direct primary care is a long way to say it's membership-based or cash-based, some people like to say, primary care. One way to think about it is the old-fashioned concierge medicine.
Sure.
But concierge medicine is very expensive, and it's priced for about 1% or less of the population.
Okay.
Direct primary care, in contrast, is affordably priced so that we can see the majority of the population. So direct primary care practices, their prices range across the country anywhere from $30 a month all the way up to $150, $200 a month.
Okay.
Typically, concierge practices tend to range several $100s a month to thousands of dollars a month. That's the biggest difference.
Okay.
Is the pricing. Direct primary care does not include any type of insurance. We don't work with insurance. We work outside the insurance system. And because we don't work with insurance and we deal directly with our patients, we work for our patients.
Awesome.
Or for clients or employers that would like to utilize us as a more affordable way for providing care for their employees.
Okay. And so what is all included in direct primary care? Like what procedures, or if I was one of your clients, what could I come see you for?
Sure. So what a lot of people don't understand or even know is what primary care is, or what family physicians are trained to do, or internists who have a outpatient primary care practice, what that means.
Okay.
So 80% of the reason people go to the doctor is a primary care issue.
Okay.
So we take care of acute medical problems. So if you have the flu, or if you have a rash, or if you have a concern about something that just came up, allergies, a new illness that you're uncertain about, we deal with that.
Okay.
We also manage chronic medical illness. And chronic medical illnesses are high blood pressure, diabetes, cholesterol, weight problems, depression, anxiety, thyroid issues. We are actually trained very broadly and can manage a multiple number of conditions. The insurance-based system limits how much a family doctor can do in their practice.
Right.
Because we have stepped out of the insurance-based system, we are really able to practice the full scope of our training.
Right.
So we do procedures in here. We can do, you asked that, so I just wanted to get
sure.
that. We'll do small biopsies and suturing and cryotherapy and nail removal, etc.
Awesome.
Foreign object removal of the eye, things like that.
So in the traditional model, where you're billing insurances, it's just a numbers game. I mean, you're getting patients in there, and out of there as quickly as possible. But here, you know, when I was researching, it seems like you can spend a lot more time
Sure.
with your clients and getting to know them. So.
Sure. So when a physician is working with an insurance company, what that really means is they're working for the insurance company.
Okay.
So every single complaint that a patient comes in with is a claim that is filed with the insurance company, and then they decide whether they should pay for that or not.
Right.
So because of that, a typical primary care doctor will have to see anywhere between 20 to 40 patients in a day.
Right.
And that means you spend about an average of 7 minutes with your doctor.
Right.
And you usually see them 2 times a year. Some people see them 4 times a year if that physician practices in that way.
Right.
But even the people that see their doctor 4 times a year are on an average seeing them for 7 to 15 minutes. In contrast to that, in a direct care practice, because we're not paid based on
Right.
how many complaints you have or how sick you are or how old you are, we will take care of you no matter what you come in with, and we will spend the amount of time with you that you need.
Right.
We're not pressured to limit the amount of time we spend with you. So direct care physicians will spend anywhere from 15, 20, 30, 45 minutes with their patients, depending on what their patient needs.
Right. You know, I was one of my neighbors, she's looking for a new doctor, and I think one of her major complaints is, you know, the bedside manner. They just don't have enough time, and really they can't afford to do that in that model. But, you know, this might be something that she should look into, is direct primary care, because she's very needy. Not needy, but, you know, she just wants the attention. She wants to know that her doctor cares about her and understands, you know, what she needs.
Absolutely. And part of it is to reframe that people like information about themselves.
Right,
People like
sure.
information about their health, and they
Sure.
like to understand what's happening and why things are being done the way that they're being done.
Sure.
Most people like to be part of making decisions about their health and their welfare, or their family member and their family member's welfare, if you're talking about a child or the elderly.
Right.
And traditional insurance systems don't allow for the kind of time that's necessary to be able to fully educate or inform our patients.
Sure.
We are able to do that. We're able to counsel our patients heavily and inform them about what to expect and why we're doing what we're doing. And what's drastically different is we're able to inform them about what it will cost.
Right.
And so when we order tests, we sit in the room with the patient, and we're able to say, this is what this will cost, and this is why. And we also we have the time to share with them how good that test is,
Right.
because not all tests are perfect.
Sure.
No test is actually perfect.
Right.
So every test has a risk of being wrong, either wrong in telling you have something you don't, or wrong in telling you don't have something that you may have. And if people are paying for a test and purchasing it themselves, they want that information, and we have the time to give it to them.
Right. Transparency is key. I mean, I hate going to the doctor thinking I'm paying one thing, and then I get a bill 2 or 3 months later, I'm paying something way different.
That's right.
That's very frustrating. So
Yes.
in this model, I mean, you know exactly what you're paying ahead of time, and, you know, it's at a huge discount from what I've gathered.
Very much so. And the biggest reason for that is because we're dealing directly with our patients. There are not layers of people or layers of administrative work
Right.
between what we need to do to help you get better and what you need to do to access us and what you need to get better.
Right.
So
Sure.
that's whether it's testing to get at what the problem is, or whether it's treatment to give you the medication. We dispense medications in the office. Most direct care physicians do.
Okay.
We have wholesale suppliers, the same suppliers that supply to the pharmacies in the community
Right.
supply to us. The difference is we pass the cost savings on to our patients. So we have patients who come in and they're used to paying, say, $100 for a medicine a month,
Right.
and they come into our office and they're getting that same medication, and they're getting a 3-month supply for $10 for 3 months. That's the
Huge
difference.
difference.
It's huge. It's a game
Huge.
changer.
Yeah, for sure. So, you know, there are times when, you know, we have major sicknesses, or we need a
Yes.
surgery, or we have an accident.
Right.
So in those cases, what happens?
Sure. So we don't do surgery in the office.
Okay.
We also don't do trauma care on the street roadside, and we don't do cancer care.
Okay.
So we don't do the things that can be done in the hospital. We do what can be done is what we term predictable in the course of life. The unpredictable events are really what you need insurance for, and it's no different from, say, car insurance.
Right.
You're not expecting your car insurer to fund your gas or your tires or your windshield wipers,
right.
or even if you have a small fender bender. Many people opt to pay out of pocket because they don't want their premium to go up.
Absolutely.
So this is very similar to that. We take care of 80% of what we expect in a normal lifespan for most people, but insurance is there for the unpredictable events.
Right.
The emergency care. And people under our plan are seeking emergency care for true emergencies.
Right.
Unlike what many people who have insurance and have a doctor and have full benefits and are employed are going to the emergency room because they don't have access to a doctor when they really feel like they need to.
Right. So in that case, would you recommend them get a high deductible insurance plan, or do you talk to people about the types of insurance they have, or do you deal on that side?
We don't.
Okay.
We are familiar with different insurance general options. We're not in the insurance space.
Okay.
Everyone needs a form of insurance. You don't know what will happen tomorrow.
Sure.
You could be diagnosed with cancer. You could have a major accident. You could have the need for specialty treatment that is unaffordable and catastrophic.
Right.
And so for that reason, insurance is very important. But the most plans, from my understanding, are high deductible now, no matter what they cover. But
That's very true. Yeah.
they are. So what we term it is sort of a wraparound policy.
Okay.
That primary care is something that you will affordably be able to fit into your budget based on what your income is.
Okay.
And then the insurance is purchased to wrap around that for the unexpected. And generally it's quite a bit less.
Okay. And then what access do they have to you? Is it 8 to 5, 9 to 5, or do you have an after-hour service? How does that work?
Our patients can access us 24/7 by technology. Technology is an amazing thing. It's enabled us where when we were growing up, doctors had pagers and they'd get paged and they'd find a phone and they'd call back and rush in.
Right.
We don't have pagers anymore.
Sure.
We have cell phones and technology, and we're able to get text messages and email and phone calls from our patients. Because we have a small number of patients, most direct primary care doctors have on average anywhere between 600 and 800 patients on their panel. We know our patients very well.
Sure.
And so because we know our patients well and we spend time with them, there are many, many issues that we can handle without inconveniencing them to have to come to the office or take off work or bring their child a sick child to the office. We generally bring people in when the physical exam is needed or when we have an appointment. We have normal clinic hours. We see patients 2 to 3 days a week, and we see them from 9 to 3 or 9 to 5 on certain days. And so the access is, I would say, very good and very convenient.
Awesome. Yeah, I know in the traditional model, like my daughter, she'll have strep throat and we have to go sit in the doctor, and that's just a huge process. And I was reading where a lot of the times we could just call you or text you and you could prescribe it all over the phone, and it's really convenient versus taking off of work, doing all the other stuff that you have to
sure and
doing that model.
Right. And the question that colleagues often pose is, you're diagnosing strep throat over the phone, and it's not quite that simple. We'll number one, get to know you and know if you're someone who, most of the time it's a viral illness that's causing a sore throat and fever in a child. But there are other criteria. If you send me a picture of her throat and it truly does look like strep, then we may have you come in here and do a culture and a rapid strep to call in the antibiotic. But 9 times out of 10, what you need from me is to hear that she doesn't have something that's going to harm her, that she will get over it in the next day or two, that she won't have any heart problems or kidney problems, and that's why antibiotics aren't required right away.
Right.
And just hearing that is what many parents are looking for, and the schools knowing that, as opposed to rushing into urgent care or an emergency department and spending hundreds of dollars, if not thousands.
Because again, stuff that you can handle by phone or through text, in order for the other doctors to get paid in that model, you have to have an office visit.
Exactly.
So it's
there's no incentive.
Right. No, totally understand. Is there anything that I haven't asked you that you want to bring up about direct primary care?
I think the thing we haven't talked about yet is how it would help employers. I know right now that we have a lot of uncertainty in healthcare
Sure.
at this time. Healthcare's been uncertain, I think, for quite a while, 2 decades.
Absolutely.
We're about 25 years into reforming a 40-year problem, and it's I was talking to someone this morning, a $3.5 trillion problem that we're trying to solve. So it's going to be a long haul. Having said that, recent changes in regulations and in insurance requirements and laws have put some business owners in a tight spot where they're feeling the requirement to provide insurance that feels unaffordable, which is true. And while that may not always be the case, if it is today, direct primary care certainly offers an option for them.
Okay.
We work with businesses to provide rates that for this type of primary care, and then they only have to purchase the wraparound, and HSA funds can be used for DPC.
That was going to be my next question. Can HSAs fund it? Okay. So, let's say an employee has 20 employees. What does that look like? Or I'm trying to think of, so you would just contract with the company and any of their employees could come to you at any time. They just pay a certain dollar amount per month.
So the way that usually works is we have a relationship with the employer.
Okay.
The employer usually presents the option to their employees as either the only option that they're providing for care or as one of other options.
Gotcha.
And some employers, most employers opt to allow their employees to choose what they want. And if the employee chooses to be part of our practice, then they enroll in our practice, and we use the HSA card for the billing every month. Our billing is monthly.
Okay.
We have a fee-for-service menu. We
Okay.
do. We've learned over time that not everyone wants to be locked into a monthly arrangement.
Right.
So we do have the option to come in and visit for an hour, and there's a particular price on that. It's obviously a little bit higher than the membership prices, but we have scaled that to phone calls and different things.
Okay.
But the main idea here, I think, behind it all is to step out of insurance for what you don't need insurance for.
Right, absolutely. And then you mentioned month to month. Do you have like a contract, like a 6-month or 12-month, or you just bill?
We don't have a contract.
Okay.
We do ask that our patients stick with it for 3 months to trial it out.
Okay.
Again, we don't have them sign a contract at all because we feel like our approach to this now. I'm qualifying what I'm about to say with, if you've seen one DPC practice, you've seen one DPC practice. Like every direct care doctor sort of does it a little differently.
Right.
It's their own way of approaching it. Our approach at Crescent is that if you're unhappy with our services or we haven't met your expectations, you're not locked into paying us. I mean, you're free to find somebody else who's the right fit for you.
Okay.
So we don't lock you into anything. We do ask a 30-day notice for canceling the membership. That's primarily for continuity of care. We don't, most of our patients have some kind of treatment that they're on, something that we're monitoring them for. And so in order to hand that off responsibly, in order to make sure that they're safe and the loop has been closed with their treatment, we require a 30-day notice.
Okay, awesome. And then one other question that I wanted to ask is, what about pre-existing conditions? Do you accept anybody, or is there a certain health requirement?
Sure, that's a great question. The pre-existing conditions that our prices are based on are your age, and that's it.
Okay.
Yeah.
Okay.
So kids 19 and under are in one price bracket.
Gotcha.
Adults between 20 and 44 are in another bracket, and then 45 to 64 are in another bracket.
Okay.
And 65 and up are in the fourth bracket. And the reason we break it down that way is just because of the particularities that are specific to each age group.
Okay, awesome. Anything else? Do you have any promotions, or I don't know if you do that here? Anything else you want to end with before we
No, I mean, I'm excited that you've heard about this. I'm excited that people are interested in it. I hope that they'll look into direct care. The number of direct care doctors in Oklahoma City and in Oklahoma is growing. Across the nation is growing. I think that both physicians and patients are realizing that this is a far better option with respect to quality and cost. And I think that quality in healthcare is something that is talked about in a very superficial fashion.
Right.
The reality is that convenience, access, and feeling better, improving your functioning, having a sense of trust with the people that you're working with, all contribute to quality,
right,
and the experience.
And to me, it seems like you can only get it in our environment today in this type of a setting, just the way.
I think this is the only setting people have ever been able to get it
yeah.
in. And I say that because we're terming this innovative, but really this is going back to the way things were before. Right. Doctors and patients, doctors and nurses and patients, and not, this is not expensive to deliver.
Right.
For me to take care of one patient is not an expensive endeavor on the part of the healthcare provider. It's very different for the surgeon.
Right.
The surgeon who works in the big hospital who sees the very complicated illness needs to have the operating room and the step-down unit and the technology and the human resources,
right,
and all of that to take care of one patient.
Right.
And so that's where you need insurance stepping in. But for this type of care, outpatient ambulatory primary care, I'm not sure there's a role for insurance in the future.
Yeah, it doesn't seem like it, and it doesn't seem like it. And like I said, I just came across this type of insurance, and I came across your company, and wanted to get you on for an interview. So again, I thank you so much for being gracious enough with your time to come on and educate me, as well as all the viewers of the local Okie. So thank you so much.
Thank you for taking your time to be here.
Absolutely. Have a good one.